Hello, this is part 2 of the musculoskeletal exam. So this is the lower extremity including spine examination as well. So first of all, um, for feet examination, I can sit up a little bit higher so you can see better. First of all, you do inspect there's any swelling, any calluses, any deformity of the foot. You do palpate like there's any corn. Uh, they are also visible. There's any modules, any flat feet. Um, and then next you're gonna do range of motion. So you will do flexion of the toe, extension of the toe, inversion, eversion. Uh, and then we can move on to the flexion of the toes. So the flexion of the toe is basically just that. So we're gonna move on to ankles. So for ankle, you do the same thing. You first inspect there's any swelling, there's any deformity, any nodule discolorations, and then you're gonna palpate for any nodules or tenderness. And for range of motion, we're gonna do dorsiflexion, plantar flexion, dorsiflexion, plantar flex. For knee, you do first gonna inspect for any valgus or varus deformity. So valgus is going in together, varus is coming up, like more lateral. So you're gonna just to visualize there's any deformity at the quadricep muscle, normal hollows around the patella, and then you're gonna just palpate for like popliteal fossa just to see if there's any swelling. There's any swelling around the knee area, and then you're gonna turn the patient around to see if there's any Baker's cyst in this area. If there's a cyst, it should be around here. Like you will see a nodule popping out, like a cyst popping out. That's Baker's cyst. And then you're gonna do the bulge sign, which indicates abnormal fluid effusion. So what you do is you're just gonna just to see there's any fluid. You're gonna first push down, and then just gonna push out to see there's any fluid, moving around this area. If you see that fluid moving, and then that's a positive sign for bulge sign. And then you're gonna palpate the suprapatellar pouch, which is around this area, and then you're gonna palpate the letters, the size of the patella, to see if there's any swelling, crevices, there's any injuries. So for knee, you can flex your knee, and then you can extend your knee. The specialty tasks for the knees, we would like to perform Lehman's test, Drawer's test, and then McMurray's test. So for Lehman's test, basically what you do, you're gonna ask the patient to flex the knee for 20 degrees, and then you use one hand to stabilize the femur, and while the other hand you hold the tibia. So what you're gonna do, you're just gonna like Um, so I'm gonna actually get onto the bed so you can see it better. So one leg flex about 20, and then you're gonna have one patient like holding the lower of the femur, and then you're just gonna try to rotate, like try to see there's any ligaments problems. And then for Jarvis test, um, your patient also need to be supine, and then you flex the leg about 90 degrees, and then you're gonna sit on the patient's foot, and then you grab the upper leg and then pull anteriorly and posteriorly to assess for laxity of the respect. So I'm gonna demonstrate that again on the bed for Jarvis test. So suppose I'm laying in bed, and then you're gonna have the patient flex the leg 90 degree. You're gonna sit on foot, and then you're gonna pull the leg like anteriorly, posteriorly. To see there's any pain, any tenderness. That's a positive sign for Jarvis test. The next one will be McMurray's test. So McMurray's test, what do you do? Basically, you medially rotate the tibia, and then you extend the leg to see there's any pain. So I'll perform that on bed while I'm laying in bed as well. So you flex the leg, you'll medially rotate the leg. Flex the leg, you'll medially rotate to see there's any pain. That'll put the pressure on the ligaments. If there's any tenderness, that'll also be a positive sign for McMurray's test. So the next one, it will be hip. For hip range of motion, we're first gonna do flexion up. So we're gonna do internal rotation, external rotation, internal rotation, external rotation, adduction, abduction. The specialty test for this will be Thomas test and Patrick's test. Patrick's test also called Faber test. So Thomas test, what it does is to detect a cold hip flexion contracture. So you do have the patient to flex the right knee and then pull firmly against the abdominal. So here I'm gonna demonstrate that again on the bed. So you're gonna have the patient lay down, you flex the leg, and then you flex it out the leg, and then you extend the leg. If there's any contracture at the hip, your leg will not lay flat down on the bed. It will be like suspended in it will not touching the surface. So if you're touching the surface, that's negative sign. If you're not touching the surface, that will be a positive sign for this test. And then our next test will be Patrick's test. Patrick test also called Faber test. Stands for flexion, abduction, external rotation of the hip. So I'm gonna perform that test right now. So you flex your leg, your hip, and then you abduct, and then you externally rotate. You externally abduct and you externally rotate. So flex, abduct, externally rotate, and then the examiner is gonna push on the hip, and then on your knee of the flexed leg. So what gonna do is they're gonna push on this two area to assess there's any tenderness for the hip. So the positive sign will exhibit tenderness in the hip area. So with that, we're gonna move on to the spine test. So first, you're gonna have the patient to stand up, and then you're just gonna assess for the cervical, if there's any, for the shoulder symmetry. Is it one shoulder higher than the other? And then you're gonna just assess for any for the spine. There's any lordosis, kyphosis. So lordosis will be like leaning backward. Kyphosis will be leaning forward. I'm sorry. Lordosis will be leaning forward. Kyphosis will be leaning backward. And then you're gonna just take a look at the back. You take a look at the back. What you're gonna assess is to see there's the back for palpate for the spine. Is it in a straight line, or is it curved, concave, or convex to one side or another? And then you're gonna have the patient like stand right in front of you. You're gonna assess for the symmetry of the iliac crest. Like for me, because my left leg is a little bit shorter than right leg, so actually my iliac crest is actually lower on the left than the right. So so you do assess the symmetry of the iliac crest if they are on the same height. So for range of motion, you can ask the patient to do a few of the tests. Basically is flexion, extension, hyperextension, lateral flexion, lateral flexion, and then rotation. So I think that's all about lower extremity and the spine examination. Thank you very much.